Hi everyone, this is Dr Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Posture. And we welcome you to the Equine Functional Posture podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Okay, hi everyone, welcome to today's podcast. We are chatting with vet Dr. Lily Wilson from the UK, and it's really exciting because she's done our Equine Functional Posture course and she's progressive in rehabilitation over there. So how are you going today, Soph?
Hey, I'm going super well. This episode's been a little while in the making, teeing it up, so it's going to be a great chat. It's also, we're going to cover lots of topics and there's just lots of things to talk about and tie together, so it'll be a really fun chat.
Yeah, it's so awesome to have a progressive vet to have a chat to. We've obviously done the podcast discussing people's relationships with vets and then vets' relationships with bodywork. And so it's just so pivotal for people to have a realization that there are vets out there who have a different mindset and a different focus. So yeah, Lily, tell us a bit about you.
Oh, hi. Thank you for inviting me. I've been a vet for coming up nearly 10 years, and I started in mixed general practice. And after a few years in mixed general practice, I kind of felt like I had a good grasp of a lot of concepts and things and practical applications of things, but I couldn't go into a huge amount of depth on any one thing. So I was kind of looking for what it is I wanted to go into more depth on. And I bought a youngster who presented me with a few challenges when I first got him, both physically and behaviorally. And so I started to do some explorations into various different topics. It really struck me actually how I felt very unprepared, even as feeling like a fairly established general practitioner, that I felt very unprepared as to what it was he needed and how to investigate and help him with his physical things, and whether the behavioral things were strictly training related or whether they were actually physical dysfunctions, as in I can't do that, or maybe discomfort. So I went on all sorts of deep dives into various topics, and one of the things that kept cropping up was that posture is kind of related to everything. So there's this concept of yeah, there's this kind of I guess it's a false separation, but it's also a useful way of thinking through things, of like the physical, the mental, and the emotional. And it all ties in. It sort of has expressions in posture or can be influenced by habitual posture. So that's how I came to do the postural rehab for professionals training, which is based in the US with Dr. Karen Gelman, Dr. Judith Shoemaker, and Elizabeth Reese. And then I've also gone down some routes like trauma-informed horsemanship, and cooperative care training is the other thing. So I started with positive reinforcement training for actually specifically needle shyness for my own horse, two of my own horses. And that's turned into an exploration of what are the deep-rooted causes in different horses, and can actually even sometimes lead us to an investigation of an underlying problem that we didn't actually know was there before, because it's thrown up some signs that we can sort of follow that thread. So yeah, all sorts of rabbit holes that I've gone down with it.
Yeah, that's amazing. And you were saying before that you found a bit of a postural link, like with horses that have needle shyness.
Yeah. So that's specifically related to, on the one hand, maybe hypervigilance and being in a more like sympathetic nervous system state being more dominant, or being a bit stuck in that state, finding it difficult to come out of that state. And then also brace and tension patterns and hypertonic muscles leading to pain when a needle is introduced. So that's it could trace back to, because often we put needles in the neck for taking blood or giving a vaccine or something, and there is of course also needle shyness with needles in other locations, but the neck, because it so often shows up brace and maybe hypertonic muscles, then you have a bit of a red flag for why is that the case, and you can follow that back to various things, like maybe even, for example, sore feet, or maybe a primary neck problem, or maybe a saddle fit problem, or maybe a hind end issue. So that it's often led to the horse is needle shy, but it's not really just a question of teaching the cooperative care behavior, which I've also done the kind of deep dive into. But if we don't remove some of those deep rooted causes or address them as well, then we're working on a needle actually being really excruciatingly painful because it's going into a muscle that's rock hard or already sore.
And yeah, I mean, it's so interesting because I don't think that it's considered that often. It generally is considered to be a behavioral issue, a fear-based kind of problem, not a physical problem. But I certainly see horses who have different pain sensitivities, and obviously it does relate to what's going on within their body, and then how that does change as they become more comfortable or more balanced, or whatever it is. So it makes so much sense. But to be honest, I didn't even think of how the posture was affecting them being needle shy. So yeah, that's another aspect for people to think about.
Yeah. And scars, actually, I didn't mention that. So scars, if you're putting a needle through a scar, which may be from repeated previous needle use, perhaps, or it might be for another reason. And that can lead to some really explosive reactions, which are kind of fair enough because it's really sore.
Yeah, and scars do often have a higher nerve sensitivity. And so yeah, they can be so painful. And sometimes we can't see them, right? Yeah, awesome. So you also do a thing called a tuned assessment. I'd love to know a bit more about that.
Yeah, so that came about actually in the last couple of years that I was in practice, and I was really exploring the way that I was kind of being around. So with my youngster, when I first got him, I kind of, to be honest, found it difficult to do anything with him handling wise, which is actually a real gift because it really made me examine how it was that I was doing it. So I had two horses at the time who were very easy. They would give me a lot of leeway in what I was doing and try and figure out what it is I was asking them. Whereas he was more like, I have no idea what it is that you are asking me to do, and then get quite worried about it as well. So in the process of really examining how it was that I was being, and how clear maybe I was in asking things, how I might have been getting in the way, and how I was responding to how he was feeling about situations, I started to, maybe a bit unconsciously at first, apply that in how I was examining animals. And then I started noticing these little things that they would do seemingly in response. And then if I also responded to those, then they would do something else in response. So I started exploring this, and it could get more and more and more subtle. Like, say, for example, palpating a cat's abdomen or something, and you watch really, really closely for maybe a slight change in their breathing. Like, they just very subtly hold their breath, or actually sometimes in cats you can see it quite clearly once you look, that their pupil will spasm just a tiny bit, and then it doesn't really matter what you do in response as long as you're doing something that is not pushing them further. So it's like you're acknowledging.
Yeah.
Yeah. And often I will grade my response with their response. So say it was something really subtle, like a very slight breath hold or something, then I would probably just pause, and then I might go again and see whether something happened again. Or they often, when they get it, they give you a bigger response, and actually then they often like turn around and point or
Yeah.
something to the area. And it can actually also end up being therapeutic, because you can have areas that they haven't allowed to be touched, or that they are holding a lot of tension, and then they dissolve that, and actually maybe their lameness even changes or something.
Yeah.
Or they get a bit bigger range of motion or whatever it is. So it can also be therapeutic. And so that's the hands-on part of the attuned assessment. And then I also do a distance observation part, and I often use food or scent stations for that. And I was just actually saying before we started recording to Sophie how I was quite amazed with your equine functional posture course, the variable feeding positions part of it, where I was like, wow, because I've been using this in with food stations, seeing how maybe, say for example, there's a feeding height where they don't tip over on their front legs, they keep their front legs vertical, or maybe there's a feeding height where they don't have to tilt their head at the pole or something like that. And then what might that mean? Where might I then have to look with my hands-on physical exam to check what I'm seeing from a distance observation?
Yeah, that's super cool. And like we obviously teach people to find those positions just to help improve the horse's posture, but yeah, they're also part of an assessment as well, because if a horse, like we will say, if a horse is always lifting their front leg up, for example, when they're eating, and people say, oh, that's so cute, that he does that little thing, but you recognize that when you change the height and make it more comfortable for them, that stops, and it actually is indicative of fascial tension. So yeah, it's we can gain a lot from observations.
Well, it's like everything they do, we can tend to just blow past it and think, well, they just do that. But
Yeah.
usually, and not running the risk of getting like really overly anxious about, oh my God, what does it mean? But just
Yeah.
collect the data, and then some of it will be relevant to a question that you're asking, and some of it might not be, but it might be useful at some point for another question that you're asking. So there's kind of a balance between like sometimes when you start noticing lots of things, it can make you a bit worried because you think, oh my God, there's so many things going on. But the other part actually of the attuned assessment stuff that I have found is vital is actually trying not to interpret as you go along. So because otherwise you get this tunnel vision, you think, oh, this means this, or you focus on a problem that they already have, and then you attribute all of the signs back to that, and it can prevent you from finding something new that is actually going to help you in the questions that you're asking.
Definitely. It's kind of like the more varied spaces, it sounds like you're assessing them, in the field, and then you're assessing how they tell you about their own body, which is obviously like they are the only person with the genuine authority to tell you about their body, as much as we make interpretations, and not getting too laser focused, it just opens up the opportunity to thinking about the whole system over, the body. I was kind of wondering, as a vet surgeon, how do you think that your perspective on looking at their motion has moved or changed or diversified, from lameness assessments to how you would see dysfunctional lameness now?
Yeah. There's a few parts to that. So I think one part of it is, and this might sound like sacrilege coming from a vet, But one part of it is maybe sometimes getting one definitive diagnosis is not the Holy Grail.
Hallelujah.
Yeah. But we need a more global perspective in order to be really helpful. So for a period of time, I actually did work in small animal emergency night clinics, and like in that situation, you really need to get a definitive diagnosis because you're gonna, like open up the abdomen and find something. But in terms of something a bit more, whole horse, like poor performance or maybe nebulous, like is there pain here? Maybe finding, okay, so there might be an injury, like if you were to tear the cruciate ligaments in your stifle, for example, then that's a definable injury. But in horses, there's always going to be a knock on somewhere else. So if there is a diagnosis, I'll make two different points. So there's one thing is like a specific diagnosis if there is a known successful specific treatment for it, then it's helpful to have that definitive diagnosis, of course. And then there's the dealing with things like secondary compensations or more satellite problems that maybe came out of the original. If it was an event that caused one injury, then are we missing something that happened elsewhere in the body? And then there's also, rather than it being a single event, quite a lot of the time the things we're investigating are like overload, chronic overload. So why is it that we're getting that chronic overload? It shouldn't just be like, oh yeah, there's proximal suspensory desmitis, that's really common. Well, why is that really common? They shouldn't be moving in a way that is overstraining this structure. And if we're going to put in place a treatment or a rehab plan and then go straight back to exactly what we were doing before, we may well get a re-injury or a problem somewhere else. And the other thing with posture is that if their resting posture is also overloading structures, then recovery is going to be slower and probably not complete. So we need to look at both. How are they moving and working? And then when they're resting, are they also overloading structures? Or are they even able to rest? Because often if they have certain dysfunctions or discomforts, they either can't really properly rest standing up, or they can't lie down or get down and get back up either. So the rest and recovery as well as the motion is important.
Yeah, it's so important. We just need to keep getting the messages out there so that the vets can kind of come from that different perspective, because then we're looking at whole horse health and improving the whole horse well-being rather than just treating the symptom or treating the diagnosis. Really, there's so much more to it. I just wanted to ask, so you came into the Equine Functional Posture course, and so I just wanted to ask a little bit about how you ended up there and the value that you see in that for people, after, because you did level 1 and 2?
Yes.
Yeah. Yeah, and how that's kind of integrated into your practice.
Yeah. Well, so I heard you on Karen Rolfe's podcast, and I thought, oh yay,
Another vet. Woo!
but yeah, this kind of perspective is so important, and there isn't actually a whole lot of material on this kind of subject. So yeah, I was really intrigued by what you were teaching in the posture course, and what I found was really helpful about it, and for owners is so helpful, is this. It's a little bit like almost like injury forensics, or maybe not injury, but like dysfunction forensics. This question of why is it happening in the first place, and also in your individual horse, what is it that helps them and what is it that they need? And it goes into a huge amount of depth in a way that is really easy to apply. You know, it's like very straightforward to apply, and you can apply it in your lifestyle changes, or there's exercises and things that you can do. And I think that it's just a really practical way of having a more whole horse perspective than just kind of the more formal and very fast investigation that often happens when you have something like a lameness workup. And it's more far reaching as well, because well, one of the things that I've probably said this a lot on my own podcast, but one of my tutors at vet school said, if it's not on your differential diagnosis list, you won't diagnose it, which is very true, you know. So if you've only got this really small list of things, and then your horse doesn't have any of those, we often hit a bit of a brick wall. Whereas in your course, you know, you'll introduce all of these different possibilities for, it might not necessarily be something that shows up on an x-ray, or even if it does, there might be these other things going on, and how you can do you know, quite straightforward checks and stuff to see how your horse is functioning and where they might be painful.
That's really wonderful to hear from you.
Yeah, thanks.
Yeah, even that's framed it almost differently for me, like how you were describing that. Yeah, the checks, especially coming back to horses. Just what you said about how it's symptom based, often what you see in like a fast clinical a check over, you're often seeing a symptom of a deeper issue. Like it's almost a timeline based thing. How long has it been going on, and how long does it take before you as an owner get to a stage where it's a recognizable dysfunction that you need to take action on based on what you know is an issue for your horse? Do you often see that, you know, there's multiple points in a horse that's having, let's say a horse has hock arthritis and it's only being treated for hock arthritis with injections or some kind of therapy, that you will find a simultaneous issue in the horse that you expect to come to the surface in the future because the underlying postural issues weren't addressed?
Yes, absolutely. Yes. Actually, hock arthritis is a very good example, because they often have a posture that is overloading structures, or well, the body is kind of trying to stabilize a structure, I guess. And the other thing that I think is probably under recognized is foot discomfort. There are so many horses that have slightly uncomfortable or quite uncomfortable feet, and then that just has a huge knock-on effect on the entire rest of the body. This might be a good point for me to go into the sort of the concepts with the postural rehabilitation stuff, because it ties in a lot of what we've just been talking about lifestyle and emotions as well, and then overload and the signs that we might see. So in terms of the posture that the horse ends up in habitually, it is influenced. So the inputs to the nervous system that make the output are incredibly heavily influenced by domestication. So the three kind of proprioceptive input areas that seem to be most influential on their deciding their overall habitual posture are the teeth, the alveolar sockets in the mouth, and the jaw, the temporomandibular joint. That's one area. The other is the little muscles that act as like gyroscopes in the upper neck near the pole, and then the other is their feet. So those are, everything in the body is important for proprioception, but the inputs that they get from those are particularly influential. And if they keep getting somewhat distorted inputs from those, then you will get not quite appropriate output. So we modify all of those things in domestication. We put headgear on and bits in their mouths, and feed them differently to how they would in a free roaming situation, you know, less fibrous, with very little incisor wear often. We put shoes on or boots, and we trim, and we have maybe different terrains, but actually sometimes just very homogenous terrains that they, some horses will literally just go from a bedded stable down an aisle to a sand arena and back again. So they don't get very much information that way, or all sorts of different combinations of different terrains. So one of the most common things that we see in the postural rehab training, we call it abnormal compensatory posture, which is where the limbs tend to be non-vertical. So they're camped under, so towards the belly. And talking about hock arthritis, often if they've had a long-term abnormal compensatory posture, then that will put strain on lots of those hind end structures. Lumbosacropelvic region, they're kind of hanging off their seat bones. They have a lot of muscular tensions. Their hocks, their suspensory apparatus are all strained. So yeah, you would have a pattern usually. And I think it requires more than the symptomatic treatment. It might provide some temporary relief, which might enable you to help them to stand and move differently, but it's the underlying, they might actually have a dental imbalance that is making them stand that way, or they might have collapsed, uncomfortable feet. They could have all sorts of, doesn't actually, we have to not get into this trap of this sign means this one thing, and rather these are the things we need to check from this sign, not it very rarely goes from this means this.
It's funny you say that, because I feel like I've heard Raquel say so many times to people, thinking about how when you are treating horses or dealing with them, or you're an owner who's trying to manage your horses to improve them in a postural sense, that the theory that you change one thing at a time isn't the best format, because you have pull, tension, muscular imbalance, dental issues, hoof care, and treating all of them has a global effect. Like, you're actually bringing the body together from lots of different directions where influence comes in. Like, you're just talking about the TMJ, those small muscles in the pole, and the feet. Like, those are three spaces that have an influence. And if you don't tackle all of them, it can be hard to bring the horse back into a space. Like, it's so unlikely. It's virtually impossible one small thing, particularly, a pharmaceutical or something like that, is going to treat all the issues in your horse. And also that they have a reciprocal relationship, kind of like if you have poor hoof alignment in the hind feet and you have sacropelvic issues, you're kind of working at them from both ends. Like, one is going to solve the other. So
Yeah.
Global concept.
Yeah, I remember being told, but you have to do one thing because you need to know if that one thing works. And it's like, I remember saying to clients, I don't care if the one thing works, I just want your animal to be more comfortable. And so if we can get there in a quicker way, and then we can peel it back, like if we have to use some anti-inflammatories, get the feet comfortable, do the teeth, and change the feeding position and do some movement exercises or whatever it is, then you're giving that horse a way better chance of getting better and more comfortable quicker. And then you can peel it back again and like come back and go, okay, well, we've ruled that out, or we've ruled that out. Like, we've ticked off those boxes of balance. They are all in balance now, but we still have this whatever compensatory posture or imbalance in motion or something, but at least we've ticked off 10 things rather than just doing one at a time. And now we're everything changes slowly in the horse, and now we're 6 months down the track and we're still chasing our tail because you've fixed the feet but the teeth are still imbalanced or something like that. So
Yeah, and I kind of think that there's this relationship between comfort, structure, and function, which goes back and forth, and those things kind of arise out of each other gradually in like a bit of a snowball. But usually you don't get changes in structure and function without some improvement in comfort.
Yeah.
So particularly in the feet, for example, if you're trying to grow better structure, you kind of do have to start with comfort, because otherwise they try not to use their feet.
Yeah. Even though you might have the structure, if they're still not used to loading in that way, you've got to
Yeah.
allow them to have the comfort to load the appropriate structure. Yeah. It's so nice to talk to another vet about a holistic perspective. It's very refreshing. So thanks for bringing that. So you do a bit of rehab on your place, like you're just kind of starting up getting more heavily into the rehab. So yeah, tell us a little bit about your process and you know the changes that you're seeing in the horses, especially when you're so aware of like their behavior and emotions and feedback. Yeah, like how does that kind of all work for you?
Yeah, so I've got a few different cases in at the moment, and I have a track system set up here. They live in a herd, and they have free access to slow feed hay, and if they can cope with it, sometimes some grass as well. And then I do a combination of my attuned assessments with them. So that's the feeding and scent stations, the distance observation stuff, and then the hands-on stuff. And then in terms of postural rehab, I will do their dental work. I work with a barefoot trimmer and do boots and work with farrier as well on foot alignment and function, and then I do various exercises, remedial exercises with them for postural resets and strengthening and things like that. And then I also do some I kind of want to say ethical behavior. I don't know about modification. I'm never sure what to say. It's like training, but I try
Awareness.
to, yeah, it's more figuring out what is it that motivates this horse, and why is it that they have this so-called unwanted behavior in the first place, and how is it that we can change that by removing their need, their feeling of need to engage in this behavior. And that often does involve changing something to do with the function or the comfort of their body. So say, for example, I have some shorter stay horses here at the moment where we're kind of asking a question like, can they be ridden long term? Is their body comfortable enough and functional enough to be ridden long term? And then there are some other cases that are going through more of a full postural rehab, which actually can take up to 18 months, because it can require several dentals, because you keep sort of minimizing the malocclusions. And then it can take sometimes 2 full hoof capsule growth cycles, because all of the important thing with that is not just the alignment and the function of their foot, but it's also the mechanoreceptors that are telling the nervous system where their body is in space. They can be a bit distorted, so you need to grow those out into kind of repopulate them with ones that are sending less distorted signals, and to also get their whole body established in the new standing and movement patterns. And the track system and their kind of free roaming lifestyle is also a part of the attuned assessment, because they show so many more behaviors when they're free living than if they're confined. So quite a lot of the time I can pick up on changes based on their changing habits in just how they're conducting their day and interacting with other horses and things.
What kind of changes, when you're talking about, like, you're watching their emotions and their behavior so closely, what are the main changes that you see in them? Like, is it play? Is it, the kind of like the things you would say as a happy horse, curiosity, or, if a horse has a turn for the worse, are they going to go and self-isolate for a little while, reduce movement, etc.? What do you see?
Yeah, play is definitely one. Play and exploration. So sometimes they'll arrive and be quite inhibited about exploring, and then they become more curious about novel things and a bit more willing to problem solve. Emotions around eating is a big thing. So whether they have this worry about scarcity of food, and so they're kind of attacking their food and anxious about it, that's an important one. Willingness to move. So sometimes they'll arrive and they will just park at a feeding station for a long time and they won't really choose to move around. Interactions with other horses, so mutual grooming and playing with other horses and moving with them. Or sometimes you'll even notice things like more distance increasing signals between them and other horses and trying not to get too close if they maybe have some body discomfort and it's like, oh, don't touch me, I'm a bit sore. I actually noticed in my own horse, Sunny, the youngster who I started all of this exploration with, last year he had a foot abscess and I knew something was up because normally they would all come in a line down the track and he would be at the front. And he was about 3 down to begin with, and then he was at the back. And I thought something not quite right with him. And I couldn't actually tell what until he then got signs in his foot. But I did know that something was brewing. And the other really important thing actually is rest. So whether they start lying down and sleeping, feeling comfortable to do that.
They're good.
So it's so cool because I think a lot of the functional posture course we talk about the power of observation, and like we've done a podcast on it early on, and how much that when you, like you say, when you become attuned to those things, how much you can really pick up with your horse, and how owners can pick up things so easily. Like the number of times I say to an owner, have you noticed this or that? And they haven't. But then as they become a client of mine, then they're telling me down the track, oh, I did notice it was just standing in the paddock the other day, resting the right hind, or I did notice that didn't come up to me to be ridden or get on the float, or the interactions with the other horses, things like that. And the more we can increase that power of observation from a veterinary perspective and a horse owner, and I mean body workers are very good at it because most of the time that they're training that every day, but especially vets and horse owners, it just changes the whole conversation that you can have with the horse. And then when you go in, like you say, from that physical perspective, you've already got a whole stack of information and you haven't even had to touch the horse yet. And you're already like, okay, well, these signs have showed up. It's already maybe pointing you towards an area, or you just know there's something wrong and you have to keep searching until it becomes evident. And yeah, it's so lovely. I know I keep saying it, but it's really lovely to hear a vet say these things because as a vet, it enriches your job. Like being a vet it can be a very difficult job, but coming at it from this perspective, like I know when my perspective shifted in that way and I started to really see animals. I was just talking about it with Brett the other day when that really became apparent to me. It really helped me. Like it helped me have animals that were better behaved for examination. It helped me to get better feedback from them in my assessment, and then it helped me to help them better because I was seeing it from a much more holistic perspective. And then when you can treat them from that perspective, which at the time I didn't have the luxury of that because I was like working for somebody and felt kind of, had to treat within their kind of boundaries, if that makes sense, more traditional sense. But when you can also come at it from that treatment perspective of looking at the whole horse, like it just makes your life as a vet so much more enjoyable. Have you found that? Would you agree with that?
Absolutely, yes. And it's like you were saying, it's really helpful for the owner to give the professional that information as
Yeah.
opposed to being a, well, something's not quite right, but I can't quite put my finger on it. And then that's a very difficult place to start if you don't have kind of an in of maybe a body region that might be affected, or here are some specific signs. Okay, it might overall be a bit vague, but here are some specific signs that I've noticed. And then that also helps you in monitoring. Are we making progress? Because are those things changing? And I would say probably if the attending professional isn't really interested in that stuff,
Yeah.
then that's probably a sign that they might be a bit more like mechanistic in the view, less whole horse in the approach that they're going to take. Yeah, I think it's like you say, it's so much more rewarding and enriching to do it from that perspective, and then to see them as an individual as well. And actually, coming back to the needle shyness stuff, one of the things that I found is I noticed different individuals have different levels of discomfort around feeling discomfort.
Yeah. Yes. 100%.
Why is that in different individuals? And sometimes, it's just them, but sometimes it's because there is something, they're almost at their capacity with coping.
They've been
And
like layered.
yeah, yeah. They just can't absorb any more discomfort. And so that's also good information.
Yeah, I say that to owners. Like I was treating a thoroughbred yesterday, and he has problems, but he had pain when he was really young, and he had stifle surgery done when he was really young, and so there's potentially been chronic pain there. And now his pain threshold, like his tolerance of pain, is quite low compared to a lot of horses. Like if I touched the sore bit, his reaction to that was not just like, it was like, whoa, like don't touch it, it's so sore. And I'm like, I don't actually think it's as sore as you're saying because your body's not saying that, but his mind, like the way that he behaved was saying, like, no, 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 don't go there. So, and I think that's probably a product of his past experiences with pain that he's like, and he's thoroughbred, so they can be a little more sensitive. But yeah, it is really individual, and I've also had other vets say that, oh, the horse doesn't have a problem because it's not showing me pain. So I've seen it the other way as well, and I'll be like, no, but the horse is lame. She showed you once, you didn't listen. She's smart enough to go, what's the point? Like,
Yeah.
and not show you again. So I see that both ways. And I think we need to take that into consideration when we are assessing horses, that they do have different pain thresholds.
Yeah, that's so important. And especially in that direction where, like you say, if it's been sort of brushed under the carpet once, sometimes it can be only once, and
Yep.
then the horse guards and they're very stoic about it, and they won't really, they'll kind of deal with it and not show you again. And that's they're actually harder, I
Yep.
think, to work with because of the feedback that you get unless you can kind of open them back up again. And excuse me, sometimes if you do, or when you do allow them to open back up again, it can be a bit explosive because there's all of this stuff to come out that they haven't expressed for a while.
Yes, I was also talking to another owner the other day, and I warned them of that prospect because the horse hadn't been showing any signs under saddle. But when I assessed the body, it was kind of like, wow, I'm amazed that this horse is not showing you any signs under saddle. And I kind of warn them that perhaps when we bring the horse back into its body awareness, we may have a different response under saddle because it kind of hasn't been feeling it. It's shut down to those feelings and is just going through the motion. So yeah, I'm sometimes warning owners that that's a possibility. as well.
Yeah.
But then, you know, that's the way forward to healing. Otherwise, you have to stay in that place, which we've got to ask ourselves if that's actually ethical to do that when we know that that they're in that place because of, you know, pain and discomfort.
Yeah, absolutely. And asking that question, I think we don't do that enough. Stepping back enough to ask that question, because often we have this the aim is, here is the problem that I'm having with this horse, can we fix that? And sometimes we have to step back even further, like, what about the horse? And what might their aims be? So we might be looking at getting back to a certain level of athletic performance or something. And maybe on the surface, that is, yes, okay, that's the problem that the client has come to you as a professional about, or that's the problem as an owner that has alerted you. And so you've kind of gone in through that route. But then maybe sometimes we actually need to ask a different question. Like, I'm so grateful, for example, for clients bringing a horse with the question, can they be ridden? Not just get them back to being ridden. It's such a gift to work from that perspective instead of, can you just fix this so that this athletic performance can be restored? It's more like, how is this horse going to be happy in their life overall, long term? Yeah.
And I think we have to get away from using performance as a measure, because it is not a measure of function. It's not a measure of comfort. It's not a measure of a horse's well-being. Just because they've had an injury and then we get them back to a level of performance, it doesn't mean that that horse's well-being A is in a good place or B been improved in any way. And there's a lot of studies that have used getting back to a level of performance as a measure of success for their surgery, or like there's so many studies that have used that as a measure. And I don't think it's a good enough measure in terms of like horse well-being and welfare.
Yeah, it's a really good point. And also the usual kind of investigation diagnostic workup that tends to be followed for this very, very broad catch-all term of poor performance, or maybe behavioral horse, is often actually kind of a lameness workup, really. And so you may well be missing quite a lot of things, or you rule out those things, but there is actually still something going on. And so, yeah, you might have, well, actually, I keep being struck by the fact that this term, where you hear people say, he's been given the all clear, and you think, what? Is this an ongoing thing? Like,
Yep.
maybe if they've healed from a fracture or something, yes, they've healed from that. But this is, you can't really have that. You've given the all clear what to do anything forevermore. It's got to be an ongoing and keep on assessing. And again, with your equine functional posture course, that's what I think is really helpful for owners, is that they can have these checks. And the idea of, like, you can do some checks, say, before you ride, and then you can think, oh, today they're not really up for this, or maybe they're only up for doing some work in walk or something like that, or maybe they need to move on the lunge for a bit beforehand, not to blow off steam, they might need to like switch on some muscles and
lubricate.
yeah.
Can I ask you, we know that, like, obviously posture and everything we've just talked about has such a big determination in a horse's long-term soundness, which, long-term soundness is the goal in a state where the horse is like has genuine well-being. They can be engaged in their life, all the best things that we were just talking about. The longevity, the sustainable movement, I would say, when you see that in a horse that's getting older and they're going into the old age, it's quite like it's beautiful to see, and it's quite a sign of respect for the horse, and it's quite loving to consider their body as their getting older and while they're young to set them up for the future, starting with everything like young horse handling, early training, foal development. If there was like a recommendation that you would give people to aid their horse's well-being and posture long term, that's like the biggest comprehensive question, but even like one or two things that, you know, a recommendation you would give to people, anybody who's listening, with all your advice and knowledge.
I think, like you say, it's a multifactorial thing, but I think probably the most influential thing I would say is their lifestyle. So that's also very wide ranging. But within that, if I could pick one thing, it would be movement. And I'm going to cheat a little bit because I'll include movement of their jaw because they need to be eating a lot. So then I'm kind of not picking one thing because it's like the forage freedom and friends thing. But their lifestyle is so important because even though we do influence them a lot and we can influence them both beneficially and less beneficially, I think that the period of time where we're not interacting with them, which is actually the majority of their time, you know, in most cases, just practically, it's like probably 23 hours out of their day most of the time, is so influential on their well-being. And also they have a real kind of innate wisdom to how it is that they can help themselves. And when they don't seem to have that, I think that points to some kind of dysfunction, that, you know, they're a bit stuck in some mode that is not healthy. If we can clear that stuck point, then they can usually help themselves out. That sounds a bit, I'm being a bit vague there, but what I mean is that sometimes we a little bit have to get out of their way and then help them identify where it is we can help them where they can't do that. But things like, yeah, having the choice to be able to move is a massive thing. Making those decisions and definitely being able to chew for a lot of the day is hugely beneficial to them on all sorts of levels, mentally, emotionally, for their posture, for their metabolism, for their gut health. You know, that's huge. Yeah, and then moving around. One of the rehab cases that I have here, he has been lame on and off, but mostly on for the last 3 years, and mostly stable kept for that time. And then he's been here a little bit over six weeks, I think, on the track. And we have made some changes to his foot comfort, but I mean, that's a short space of time. And he's already so much better as he's moving around and he's made friends. They keep him moving around and playing and, yeah, exploring.
Yeah,
so, young, old, everything.
Yeah, so cool. Do you have anything that you would like to discuss, leave people with? I know one thing that you have coming up, which like we recommend, is that you've got a needle shyness. Is it a course coming up on the 1st?
Yeah, it's an online course. Yeah, so it starts on the 1st of July. So the first course materials will be released on the 1st of July. And this one, the course materials actually you have lifetime access to, but the 1st of July starts off a 12-week live running of the course. So then you get lots of live support from me. So we have 4 Zoom Q&A calls. You can book 3 one-to-one coaching calls with me as well. There's webinars, videos, PDF guides, and then a Facebook group where you can upload videos and things. And we look into the deep-rooted causes of needle shyness. So whether there might be pain involved, whether there might be a postural thing involved, whether there might be a trauma, or whether it's maybe to do with more sort of foundational communication and understanding stuff. And then I will coach you through the cooperative care behaviours. So we build a start button and an anchor behaviour where the horse can tell you, you build a predictable sequence of events so they know what's coming. You're not sneaking up on them. And it builds a lot of trust because they can ask you to pause or stop. And then I will also discuss what to do if it is an emergency or an urgent situation where we unfortunately can't always honour that. But yeah, coach you through the cooperative care procedure, and the chunking it down into those little steps does a lot to identify which part of the process they're having the most trouble with. And also they can see that you are responding to them as well. So it actually has huge knock-on effects on your whole relationship, and you can use these concepts in all sorts of situations.
I love that it has that individualized aspect to it, that you're not just teaching a specific set of steps for every horse, that you're actually taking into consideration like their underlying, I guess, story of how they ended up being so needle shy, and tailoring that to the individual. I think that's really, yeah, that's really cool, because lots of times there's just a step-by-step process for people to follow.
Yeah, and I sometimes find, not that we need to go into a big discussion about needle shyness, but I actually sometimes find that it's the restraint that they find the most worrying, not the needle. And then
Yeah, I
if it's
agree
the
with you.
needle, then it may be a pain thing. Yeah.
Yeah, I can needle, I'm gonna say all of my horses, but I haven't had to needle all of them, but I can do them all in the paddock without a halter IV.
Mm.
They're happy to stand there, and I think it's, yeah, just a bit of acknowledgement of them, that allows me to do that. So it's definitely possible, to do that.
Yeah.
Awesome. So you can find, well, where can people find you?
My website is nurturingnatureequine.co.uk, and then Facebook is Nurturing Nature Equine, Dr. Lily Wilson, MRCVS, and Instagram is at Nurturing Nature Equine.
Awesome. And we'll put those in the show notes, as well, so that people can find your courses and your information. So we'll just go through some takeaways that we have had. I've got a few. I I loved that you said that it takes 18 months for the postural journey, and because that's what I found with my own personal horses who I've gone through a postural journey with, and I've seen that with a lot of clients' horses too, but often people are not aware of how long it's going to take, and so it can be quite a difficult journey because they feel like it's taking forever, but it's very realistic to say 18 months. So I really, yeah, thought that was a big takeaway. I also thought the observation of habits, is so valuable. And as you were kind of going through the list, like their curiosity and their eating patterns, and their willingness to move, and their interaction with other horses, and their rest, I was just thinking of Jelly, because he showed stress in all of those to begin with. Like, he didn't have much curiosity. Now he tries to get out the gate, and he explores things. He didn't do that before. When he would eat, he would, like what you described, he'd eat like he was never going to get to eat again. And he was really picky at the same time. So there was like a couple of weird eating habits that he used to have. He, I guess, well, he didn't really move around much. He'd just stand and eat if that was an option. He didn't interact that much with other horses, but he also was spent a lot of time by himself. And yeah, I guess at rest his posture wasn't optimal at that point either. So, it's just really cool to be able to think back and with my own horse and see how all of those things have actually changed through his rehab postural journey, and yeah, it's really nice description of them. So And I'm just so happy again. I could just keep saying it, but it's just so nice to talk to other vets who are really, looking at things with a holistic perspective. It gives me a lot of hope for the veterinary profession in general. I mean, I do know a lot of vets who are very open and holistic, but I deal with a lot of people who are not always getting that experience, like horse owners who are not always getting that experience. So I think it gives them a lot of hope as well that there is a progression happening and a level of awareness that's shifting. And so yeah, I'm super grateful that you came on the podcast, and I really think our listeners are gonna love this episode. So thank you so much.
Well, likewise, thank you for both of you for doing what you do, and I would highly recommend your equine functional posture course, because it will just go alongside, well, anything, even if you don't currently have a problem, just general wellness really, or if you are investigating or trying to manage a problem, then it covers all bases.
Yeah, thank you. I really appreciate that. Sophie, did you want to add your takeaways?
Yes. I wrote down lots of them because it was such a good discussion. Looking at them, I think they actually come together in like a big, like a cyclical loop. So one thing I really enjoyed you talking about, because I think about it all the time, is the idea of like, what is your underlying motivator right now for literally nearly every behavior, whether it's habitual, like it's become habitual, like what was your underlying motivator? And that comes through literally everything from how you move your head when somebody is standing by your sore leg, and how they respond to us in so many ways, particularly because if you have a horse who, is like the discussion around comfort as well. If you have a horse who's exhibiting strong behaviors that are undesirable, then you have to ask yourself, what is my horse prioritizing? Because we often, realistically, when you're shaping behaviors, like actual training is in general about getting the horse to move their body and in the moment do what we want them to do. Like it's almost puppetry in a form. Even if you're having a relationship with them, you're asking them to move under your control. And so if your horse has a fantastic body and a fantastic posture, the jaw feels good, there's no feet pain, your horse's only underlying motivator is to either move towards the thing you're offering it, which is something wonderful, a reward, or they're often moving away from pressure in standard training systems with operant conditioning. And if your horse has to prioritize comfort because there's an underlying discomfort, dysfunction, pain, a balance issue that gives them anxiety, then they are less likely to give you the behavior that you want, because their underlying motivator has shifted to prioritize comfort in lots of spaces. And so I think that one point for me is a really big deal, because I think systemically we label behaviors as temperament based. And I do believe horses have personalities that they can be happy and that they have preference as individuals, but their underlying motivator changes, and the behaviors they express are the ones that we often are like, she's just being naughty. But thinking about why did my horse choose to do that, I think is a big one. So that for me is like a massive takeaway. I think the other one, what you said about giving horses all clear, and how that catch-all phrase is not the best way of describing a horse, when you're trying to say there's no underlying dysfunction, it's a pretty big term. Like she's been given the all clear, but I don't know why she's still exhibiting these behaviors. It just means, like, if you're actually seeing behaviors, she doesn't have the all clear because something is popping up. And I think my other takeaway is the relationship between comfort, structure, and function. You were talking about bringing a bit of comfort in first, and then when you gave us your recommendations, movement, forage all the time and having friends, so the way that you move, like motion is lotion for your joints. It inhibits discomfort and stiffness when you move, like in your actual joints, using your mechanoreceptors and opening the fascia and decreasing sensitivity in all of your nociceptors. So you introduce comfort through all of those things you were talking about, and then your function is influenced because you've moved differently, and then your structure adapts to represent the way that you move and your new body over time. So I think, yeah, talking about that, bringing the comfort in first, and not just with, obviously you can use things like, pharmaceuticals, etc., but how wonderful motion is for the body. And then I think my last one would just be that the self-determination, what you were saying about getting out of the way and giving them space to take the responsibility for their own body. And when you're moving, I know Raquel talks about this with Jelly and Ellie, when they lose their balance, they'll come back to a walk. So they are taking responsibility. I've lost my balance and I have a space to choose something better for myself and making the space. So I think that's, something that's really wonderful. And I think it's a gift to have, like you were saying, clients who are interested in that and motivated to have horses that have genuine well-being overall. Would be mine.
Giving the power back to the horse is
Exactly. Yeah.
is a nice place to come from. Awesome. Well, thank you so much again. And yeah, thank you everyone for listening to this podcast and joining myself, Dr. Raquel Butler, Sophie Vandenberg, and Dr. Lily Wilson. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so that we can continue to share more valuable insights.
And we'll see you in the next episode.